Turn our attention now to COVID-19 related news. The health minister apologises for not being forthcoming in recent weeks. He says over 1 million Johnson & Johnson vaccines will be ready for distribution by the end of this month. Now, South Africa's slow vaccination rollout has come under immense scrutiny, and that's as government is still administering the initial batch of the J&J vaccines to health workers. eNCA's Govan Whittles filed this report after trailing the eNCA inspection. Of course, that's the vaccination sites in Gauteng, which occurred just yesterday.
The health minister arrived here with good news about vaccines and vaccination sites being prepared across the country.
Let me then come back to the issue of today and start by apologizing to the nation for the difficulty that was caused over the past 2 or 3 weeks. It's been difficult to get new information, and that was mainly because there was no new information.
Mkhize says the Johnson & Johnson vaccines are nearly ready to go, while negotiations with Pfizer continue.
The payment processes are underway upon the conclusion of Pfizer. Upon the conclusion, Pfizer will then be in a position to break down their current quarterly commitment to a final schedule, with a committed date of delivery of the first batch.
He says studies have identified the most consequential factor in determining whether someone gets seriously ill or dies from COVID.
Whether there are comorbidities, frontline workers, everything. What determines how many people end up with severe, moderate, severe diseases and hospitalization and ICU and death is age. The highest numbers of people are affected are above 60.
At the rollout's peak in 2022, the health department expects to vaccinate huge numbers every day.
We want to ultimately get to a point where at the peak we're able to get up to 250 to 270,000 per day. So that's when we're really rolling and pushing everyone into vaccination.
After being stuck in neutral, South Africa's vaccination program is now being pushed into high gear. And by the beginning of next month, the elderly and those most vulnerable will be lining up for their jabs. Govan Whittles, Soweto.